Welcome to the Denton Surgery Patient Group podcasts. The Denton Surgery Patient Group is a group of patients of Denton Surgery who work with the surgery to improve the patient experience. We are the patient's voice. Our other role is running the volunteer patient transport scheme and in organising wellbeing meetings and events. This is the first in our podcast series, so welcome. I am Kevin Hewitson. I am the Secretary of the Denton Surgery Patient Group, and joining me today is Nicola Draper, who is the Practice Manager. Welcome, Nicola. Could you tell us a little about your role at the surgery?
So I've been here since 2013. I initially helped temporarily in admin when I was looking to change jobs, and then when I was sort of in that role, the practice manager asked me if I wanted to train up as assistant practice manager. So I did that for 5 years, and then in the summer of 2020, when she retired, I took on the practice management role. That was just before the pandemic. So I'm coming up to 4 years in post now. And basically my role is to manage the overall running of the practice. So that's health and safety, building maintenance, recruitment, HR management, taking care of all the staff, including the clinicians, CQC compliance, finance, looking at contracts and ensuring that we're delivering them correctly, running campaigns like flu clinics, COVID clinics, and developing practices, policies and procedures, and responding to patient feedback and complaints.
Is that all, Nicola? Is that all?
Yeah, it's jack of all trades.
Right, well the topic for today's podcast is the dispensary. Mm-hmm. And we know as patients how busy the dispensary is, with over 6,000 patients attached to the surgery, mm-hmm. and most of those seeing either the dispensary for their medication at least once a month. So you must be very busy. My first sort of question really is, do all surgeries have a dispensary?
No, to be a dispensing practice, there are very tight rules around that. Dispensing doctors are general practitioners who provide primary health care to about 9.9 million rural patients. Almost 3.5 million of these patients live remotely from a community pharmacy. So dispensing doctors are allowed to dispense medicines they prescribe for these patients. We can't sell products like pharmacies do. And only certain patients are eligible to receive dispensing services from their doctor. We can only dispense medications to patients that are registered with us and to those who live 1 mile or more from their nearest pharmacy. And I'd say roughly 7% of all prescriptions in the UK are dispensed by dispensing doctors. So there's not loads of us.
No, and I think at Denton we have a particular challenge with 15 villages in a rural setting, mm-hmm. all trying to get to a pharmacy, mm-hmm. to get their prescription. So Denton provides quite a pivotal role, mm-hmm. I think, in doing that. Yeah. So where would patients have to go then if Denton did not have a dispensary?
Our closest pharmacy is Boots at Riverside. Obviously patients could choose to go to any pharmacy of their choice, but that's our closest, which is some distance. But obviously the unique benefits of dispensing doctor service are that it provides access to medicines and general healthcare under the same roof, and that can be really convenient for our patients. So if a prescription is sent to a pharmacy, for example, and there's an error, the patient has to travel back to their practice to sort any issues out, but we have the opportunity to nip these mishaps in the bud, popping into the clinician who will often get back to us immediately, sometimes the same day or the next day, depending on the severity of the issue. But when using pharmacies, pharmacy staff will make the patient do all the legwork. So if there's an error when they get there, the patient is on them to go and sort that out and go and speak to the GP practice again. So having a dispensary attached to your doctor's surgery is a real benefit.
Wow. It's much better than sort of, I suppose, going to Boots, getting told you can't have your prescription, then having to come back to the surgery, make an appointment, mm-hmm. or seeing the GP again, then getting the prescription, and then going back again. Yeah, lots
mm-hmm.
of advantages. So, how do you go about getting a prescription filled?
Dispensing itself refers to the process of preparing and giving medicine to a patient on the basis of a prescription. So it involves the correct interpretation of what the prescriber has requested and the accurate preparation and labelling of that medicine. So there's two separate streams of fulfilling prescriptions. We deal with acutes, so these are kind of like for same day issues really. They usually come on the same day as a result of a same day consultation. So for example, a chest infection, you might be prescribed antibiotics. This would be known as an acute. Sometimes acute requests will come from a patient, so they might say, I've got an ear infection, I always get this, I think I need antibiotics. But these would all still have to go through the GP for their authorisation. So the dispensary endeavours to get all acute prescription requests ready within 24 hours. And then we've got repeat medication. So requests will come in. The patient usually requests their repeat medication monthly. This can be done by ticking our repeats slip, which is available in the surgery. They can send it in via email, via the NHS app, or System 1 online if they're signed up to that. Or they can do it in person at the dispensary hatch. We can't take prescription requests over the phone for safety reasons, unfortunately. Once the request has been received, it has to be authorised, and that's before the dispensary can do any work on the request. So it has to go off to the GP. The GP will look in the patient's notes. They may need further information at that point. They might need up-to-date BP readings or blood tests, and then they can reauthorise. And once the prescription has been reauthorised and signed by the GP, then the dispensary can start their work.
Quite an involved process.
Yeah.
But one, obviously, for safety reasons,
Yeah.
to ensure that the right medication gets prescribed. So how long does a repeat or regular prescription take to get filled?
Yeah, so once the patient orders the medicine, this is classed as sort of day zero really at the point of ordering. The medicine will then be ordered on the day that it arrives to us. So by day one, the medicine's been ordered if it's not in stock already. Often the medicine on the day of ordering will arrive that afternoon or the following day. The medicine is then picked. It then has to be labelled whilst they check if the label's correct, the correct patient, the correct dose, the correct item, the correct quantity. It then has to be bagged, and then it can either go into the 24-hour collection point, which we'll probably chat about a little bit later, or the staff then manually have to text the patients to let them know that they can collect it at the hatch. And because we dispense to we do about 12,000 items per month, the team do require 5 working days, because there's a lot that I've outlined in that process there, and that's how long it takes us really. So for example, if they put their request in on a Monday, it will be ready the following Monday. All requests received over the weekend won't be actioned until Monday or Tuesday because of the volume that we receive over the weekend, and they're processed in the order that they're received.
Yeah, I think one of the patients has raised the issue of the NHS app. When it says issued on the NHS app, it doesn't mean to say that the surgery is actually issued.
No.
It just means that the request has been issued to the surgery.
Yeah, unfortunately it's a terminology between NHS app technology, which we have nothing to do with, and patients' kind of perception of what the terminology we use here when we say issued. We mean that the doctors looked at it, or reauthorised it, signed it, and issued the script ready for dispensing. But obviously it doesn't match up with what the NHS app uses.
I mean, luckily for things like this podcast, we can bring that to the attention of people who are listening, that if they're using the NHS app and they go on the next day and it says issued, there's no point in trying to come round to the surgery or to ring up the surgery and say, my medication's ready, I've come for it, because it just means it's on its way to you.
Yeah, exactly.
Brilliant. Is it true that some medications are in short supply and some are hard to get hold of?
Yeah, unfortunately there's many reasons why we're not always able to get certain medicines. Shortages can occur for different reasons. Sometimes manufacturers of medicines can have problems with making the medicine, transporting it, or problems with ingredients for medicine. Sometimes when lots of people are suddenly prescribed a medicine, this can use up the available supply. So for example, Ozempic is the kind of common one at the moment that is used for management of diabetes, but it's also been approved for weight management. So Ozempic has suddenly become a very popular drug. That's just one example. And then we have a lot of issues with HRT medication as well, because it's just in such short supply. There's been a growing number of medicine supply issues for a combination of reasons, particularly in the first half of 2022. And we've seen that our team are spending an increasing amount of time just trying to source medicine for patients.
Right, so that's taking up their time when they would be normally with dispensing. But that's something out of their control, isn't it? They can't control what medications are in short supply or which medications are becoming popular. I think you're going to go on to talk a little bit more about that.
Yeah. So, unfortunately, the dispensary is not always able to stock all the medication, so it's not always available on that day. Occasionally, even though we ring round wholesalers for stock, we're sometimes unable to get it, because if the wholesaler hasn't got it, then we have no hope, because that's where we get it from. The dispensary do try to communicate to the patients that are affected by this. This can be by text or phone. They may be able to give you some of the medicine that you need, but not fulfil the whole amount. So when this happens, it's known as an owing, and we can sort of text the patient and say, these items are ready, but we've ordered this, we're trying to get hold of this, and we'll let you know. They may be sourcing your medicines from different suppliers or are waiting for the order to come in. Sometimes they may need to speak to the doctor to get a different medicine prescribed for you because it's that difficult to get hold of. But all of these decisions have to go through a GP. So it can add on an extra day or two sometimes to the process, because they have to be approved by the doctor. And the dispensary won't always know that something's not in stock until they try and order it.
Yeah, and it's not just this dispensary, is it? A lot of dispensaries face the same issue. I mean, we've heard from patients where they've gone to Boots and then gone to Lloyd's and then gone somewhere else and gone in a circle trying to find a medication.
Yeah, well, just going on from that as well, we've also had the question of, well, why didn't you have it? I went to Boots and they had it. But there's lots of reasons for that. Pharmacies might use different suppliers or wholesalers to source medicines, so availability will depend on whether each pharmacy's suppliers have stock or not. Where there's a known shortage of medicine, supply levels can change really quickly. So this can be different from different areas. It can kind of be different across the county and particularly the country. This is why pharmacies in one area may be able to find a medicine and others may not. Some manufacturers and suppliers might restrict the amount of specific medicine that a pharmacy or a dispensary can order. It's known as quota allocation, and we're seeing this more and more, where once we've met our quota, so that supply and demand isn't exacerbated, they put a quota on your order and say that's it now.
So it's a bit like how many toilet rolls you can have in Tesco's.
Yes. Yeah. And then, but obviously the patient doesn't know that, and then, understandably they're frustrated. But unfortunately, these are the kind of issues that we're working with.
Yeah, brilliant. So if I can't get my medication from you, I may have to go somewhere else, but they might be facing the same problems as you.
Yeah.
So you might be on not quite a fool's errand, but you might be spending a bit of time going round. I can imagine that the anxiety that must bring to patients as well.
Yeah, and we understand that, and often patients will say, well, can you ring round for me? And whilst we'd love to have the resources and time to be able to do that, unfortunately we just can't take that on. It is the patient's responsibility to source their medicine where we can't get it and where we've tried. And we will always try and get them an alternative, but that takes time, and that can sometimes add a day on to the request.
Yeah, I can see the benefit of the dispensary in terms of convenience, especially with a rural practice such as this. We know from the volunteer patient transport scheme how difficult it is sometimes for patients just to get out of their village, never mind down to a pharmacy, and then sort of several pharmacies. Yes. Okay. Our next question was to do with the wonderful self-service machine, I think, was that? Yeah,
so I think it was probably one of the best investments we've made, actually. It's really improved patient satisfaction. We wanted to do something to tackle the lengthy queues that we were seeing for medication. We were seeing queues right up the path at one point, which was really demoralising for not only us but for the patients as well. And because of the layout and size of our dispensary, employing extra staff wasn't the answer. So we learnt about the 24-hour collection point at a trade show a few years back, and so we just took the plunge. Once the team had prepared the medication and bagged and labelled the item, the team load eligible items into the machine. The machine automatically lets the patient know it's ready to collect via a text message. The patient is sent a PIN number to pick up their meds. When they collect their medication, even when we're closed, the patient follows the on-screen instructions, enters their PIN, enters whether they have a medical exemption, which means they don't have to pay, or if they aren't exempt, they can pay at the machine. So it's been a real kind of handy thing to have for when we're closed. It means patients can collect 24 hours a day, 7 days a week. So we've found that it saved patients time from queuing at our kind of pokey dispensary hatch. It also saves the team time from individually serving 500 to 600 patients a week. That's how many patients pick up from the point.
That's quite a long queue out the door, isn't it?
Exactly. So it's a choice to use it. Patients don't have to use it if they don't want to. If they don't want to, they can continue to collect from the hatch, and the team are more than happy to continue to serve them face to face when we're open. But it's just an extra option for the patients to give them that convenience.
I know there was a few teething problems, wasn't there, and people getting used to the idea that they have to collect it within a reasonable amount of time so that you can free up that space to put another prescription in.
Yeah, I think that's probably the biggest frustration we have with the machine. If the patients don't collect their meds in the allocated time, then the item will be removed from the machine, and they'll find that they have to go and collect it. Their PIN won't work when they get there, and they'll have to come and collect it from the hatch during our opening hours. So we do give patients 3 days to collect their medicine. This is to allow as many patients as possible to benefit from using the collection point, because it's extremely popular. I know it can be frustrating for patients, but it's really important that the window is restricted in this way to allow everyone who wants to use it really. One of the biggest frustrations is when patients fail to collect within the 3 days. The team have to manually remove each item from the machine. On average, we're seeing figures of between 70 to 90 packages uncollected each week. And we've worked out that it equates to 6 hours of one staff member's time just to empty the uncollected items out of the machine.
Yeah, when you put those figures on the table, it's quite surprising, isn't it? Because I mean that's a day's work almost.
Well, that 6 hours is time that someone could be spent sourcing medication that we're struggling to get hold of and getting more dispensing done at the end of the day. There is one other frustration when it comes to the machine. It's unfortunately a minority, but some patients can hit and shake the machine while they're waiting for the medication to come down the box. So the screen does say that the box is locked and just wait, just pause for a moment for it to open. But unfortunately, people are just so desperate to get their medication. They'll shake it and bang, so they just need to be patient, and it will drop because it can cause technical failures and the machine goes out of order.
I did actually witness somebody yesterday just constantly tapping the door to see if it was open or not, or when it was open.
And it does tell you, just hang on, because when that hatch is shut, it's not... the medication's not there waiting for you to get it. It's because the machine has an arm and it's actually going to collect your medicine from within the machine to then drop it into the box. So it needs that time before it can open the drawer and let you take it out. So we would just ask patients not to shake it and bang it, please.
It's not giving out those auto vending machines where people sort of, I want me Mars bar.
Yeah, exactly. But overall, it's been a real hit with the patients, and patients who were really reluctant at first love it now. So it's been really fantastic, and I wish we'd had it in the pandemic because it would have been so great for social distancing.
Yes, yeah. I mean, the Denton Surgery Patient Group was involved in giving out and taking prescriptions into the community and picking up scripts and bringing them back during the pandemic. So I know how busy we were, so that's only a small portion of how busy you are on a daily basis. If we could move on to the sort of home delivery service, because that's another key issue of having so many villagers in the surgery.
Yeah, well, we do have a home delivery service, but it is just for very vulnerable and isolated patients only. It's a free service, but we have to make sure that it's just for those who have no family or carer support and those who don't drive. So in order to be eligible for that, a GP actually has to look in your notes and let us know that you're eligible for the service. But with the collection point now, we've got a really good alternative for people who have got cars or neighbours or friends who can collect for them. But we also deliver once a week to Brayfield, Hackleton, Yardley and Cooknoe. There are restrictions on what medications can go out to these remote delivery sites. For example, controlled drugs can't, for obvious reasons. But yeah, we have got that option as well.
Right. Well, we've talked a lot about the actual practicalities of how the surgery works and the dispensary works within that environment, and also the benefits to the patient. What are the benefits to the surgery of having a dispensary?
I think it definitely, the income that the dispensary generates allows us to invest more into the practice. So the cost of providing healthcare services in rural areas has gone up so much over the last 5 to 10 years in particular, and the dispensing income allows us to employ additional nurses, additional GPs, additional reception and admin staff, and that directly affects the number of appointments that we can give to patients. We offer more appointments because we have a dispensary.
So the sort of quality of service that our patients get in the Denton surgery practice is enhanced because of the dispensary.
I would say so. If we didn't have a dispensary, we would probably have 2 receptionists, and we have a team of 6 to 7. We would probably have 2 to 3 doctors. We have 7. And we would probably have 1 practice nurse and 1 prescriber, and we've got 2 of each.
That's absolutely brilliant, isn't it? So it makes a great impact.
It really does.
So something we've got to make sure that we keep.
Yeah, I definitely. I mean, if I was lucky enough to have a GP practice that had a dispensary, I would absolutely use it, and I wouldn't be going elsewhere because I know the value it's bringing to me as a patient. It also, it's great for the staff because it allows us to be a real living wage employer, for example. That's an independent body who have who set the recommendations for pay much higher than the government's minimum wage. Unfortunately, the NHS, the government only provide the NHS enough to pay their staff minimum wage, but because we have a dispensary on site and the income it generates, we are a real living wage employer, so no one at the practice will earn below £12 an hour, no matter their role, from the 1st of April this year.
That's absolutely brilliant, isn't it? So there's all these hidden benefits as well.
Yeah, there's a lot of wide-ranging benefits. Yeah.
All right. Well, many thanks, Nicola, for talking with us today about the working life of a dispensary, I suppose, in many ways. And to the people who are listening today, remember that the Denton Surgery Patient Group is your voice, and we can be contacted at in any of the villages. Our contact details are on the notice board in the reception area. You'll notice where the books are. We should have a list of people there. But also you can get in touch with me at secretary@dspg.me. So that's by email, secretary.dspg.me. And you can leave a message there where we'll certainly get back to you. Well, I hope you've enjoyed our podcast, and I hope you will join us next time when the next topic's going to be the primary care network.
Yeah.
Whatever that means.
Yeah, lots to talk about. And obviously, if patients do come back with particular queries or questions about a particular topic, we can always put something on, or we can go into more detail. So today was just really an overview. I could talk so much more about the dispensary and lots of subjects. So any questions, or if there's kind of an overwhelming response and people want to know about a particular thing, I'm sure that we can put something on.
Yes. So please get in touch with the Denton Surgery Patient Group. Don't ring through to the surgery itself with questions as a result of this podcast. You'll find that they're quite busy as it is. So
Thank you.
But better to direct it to us. Well, thank you very much, and we look forward to you next time.